Dr. Kruti Patel is here. Thank you so much for being with us. And
thanks for having me.
You are a radiation oncologist at GBMC, so this is your specialty.
Yes.
And I know you work very closely with Dr. Fogarty.
Such a pleasure.
Oh, that's great. And that's what I love about GBMC. Honestly, it's a team approach. Everybody's involved. You know, you're not just seeing one physician.
That's the way oncology works best, is if it's a team approach.
Okay, so let's, we just heard Dr. Fogarty talk about, particularly when you're just even getting a lumpectomy, which I don't even think I realized, that you automatically, in most cases, will have some radiation to go with that to make sure.
Right. So most cases, not all.
Right. I don't want to ever say all or never.
Because as Dr. Fogarty was talking about, there is a population of women based on our studies that establish the role of radiation in breast cancer. We know that there's a big chunk of women actually who do fine after a lumpectomy. And so there has been work done throughout the years and the decades to kind of help us figure out who's in that big group of women that would do well with just a lumpectomy. And she talked about women over the age of 70 who have really favorable features, sometimes women with a DCIS or stage 0 breast cancer, again, with favorable features in certain scenarios.
Isn't it nice to be over 70 and here you have favorable features?
Yes.
I like that.
Right. So, there are women that can be served with a lumpectomy alone, but typically, yes, breast-conserving therapy usually means that the lumpectomy goes hand in hand with the radiation, and the radiation is very much so about saving the tatas, literally, because decades ago, whether you had the little breast cancer or the large breast cancer, mastectomy was the only option for a woman, and we've come a long way from that, especially in this country where really the standard of care and the treatment that is used most often is a lumpectomy with radiation.
Yeah, and also, I mean, back then they would do what they called a radical mastectomy, right? So they're taking lymph
now we're going
nodes
way back.
Yeah, right? But, I mean, which led to its own issues with edema and all kinds of...
And Dr. Fogarty didn't get to that point, but, a lot has changed with lymph node management. Surgically, they're doing less, and some of that even comes into play because we're able to treat with radiation in a way that's a bit more sophisticated and able to treat. So it almost seems like sometimes we're treating lymph nodes more with the radiation and less with the surgery, because that does lead to fewer side effects in the long run.
Let's talk about what radiation...
Absolutely.
I mean, in most cases we hear about radiation, we're like, ooh.
Right,
but
exactly.
It's really a pretty amazing thing.
It's very sophisticated. So radiation, when it boils down to what I tell all of my patients, is it's X-ray therapy, typically. So same type of energy that's in a CAT scan or a typical X-ray that you would get. But what's different with the radiation we generate with our machines, which are called linear accelerators, is that the radiation is more penetrating and it's stronger because we're not trying to take a picture, but we're trying to eradicate any microscopic cancer cells that might be left behind in the breast. And the other way it's different than a diagnostic X-ray is that it's also far more sophisticated in that it's way more targeted and that we can somehow control the dose so that it's really going to the areas that are at risk or that need to be targeted, and then we can minimize the dose as much as possible to like neighboring structures such as the heart and the lung in the case of breast cancer. And basically, radiation is dangerous if it's not used properly.
I'm just curious too, you were talking about the heart and the lung, particularly the heart. Is radiation on the left side harder than radiation on the right side?
I would say...
More complicated?
Right. So there's, I wouldn't say harder, but it's a bit more involved.
Okay.
But you're right. We will automatically think about a left-sided case differently than a right-sided case because in most patients, the heart is left-sided. At this point at GBMC, pretty much for all patients that have a left-sided breast cancer after lumpectomy, we are treating them with an approach to specifically try to minimize the dose to the heart. So the most common way that we achieve that is by implementing what's called deep inspiratory breath hold. That's kind of what's involved, is taking in a deep breath and holding it. The reason for that is when we do that, physiologically, the heart moves back and down, so away from the breast, so it creates distance. That's one of the most effective way to minimize radiation to a person or a target, is creating distance is one of them. So we kind of...
So you would lie there for the patient, take a deep breath, you would radiate, And then you let it out. That's
Right.
Kind of
So usually, and we
push
have
the heart back.
Yep, we
by
have
doing
them.
that.
We
Interesting.
coach them. We do all of their planning in this way, so we can calculate and measure what doses would be going to that heart, and there's amounts that are acceptable, and we try to keep it as low as possible, which we're pretty good at nowadays. But yes, during their treatment, it's just that. So there's a camera that's on the patient, and our therapists are at the console, and they'll say, okay, Mrs. So-and-so, go ahead and take a deep breath and hold it. And we have a couple of different ways. There's some technology involved to gauge that the breath is appropriate and where it should be. Once we see that it's in that zone, they'll turn on the radiation, and so the radiation will be administered, and they'll stop and they'll say, okay, go ahead, relax, take a few breaths, and then they'll redo that. So we split it up so that you're only taking that deep breath in for like 20 or 25 seconds.
I know that every patient's going to be different, but can you feel the radiation when it's happening?
Typically, no.
Okay.
So I say typically no because that you're not really supposed to, right? But do sometimes people say that they do? Rarely. So when I counsel patients when I'm seeing them, I say you don't feel it. You don't really hear the radiation. You do hear the beeping and clicking of the machine. You will see this large machine moving around and rotating. You will see lasers. But otherwise, it's just like getting an X-ray, CAT scan, or your photo taken. You're holding still, and the X-rays are going through you.
And I've known people who've gotten radiation, and they'll go several times for small doses.
Right.
How long does it last? On average? So
that's a great question. For breast cancer, for many years, typically it was a course of about 6.5 weeks, or in the range of 30 to 33 treatments. But over the past few years, we've really had a lot more literature and data come out where for most early stage breast cancer patients, we are safely and effectively able to treat them in a shorter course of about 4 weeks. So that's shortened up a little bit.
Hour visits, half-hour visits?
So the first visit is typically longer, but once you're in the swing of it after your second, you're really in the treatment room for maybe 15 minutes. So we have like kind of 15-minute intervals, so it's pretty quick. And the time that the radiation is on is just a couple minutes. Much of the time that a patient is in a treatment room is really spent making sure that they are properly aligned and positioned okay, because all the sophisticated planning we do on the computer for the radiation to tell it where to go is only valid if the person is in the appropriate position. So that's really what, it's kind of the whole measure 4 times, cut once, because once you give radiation, you can't take it back.
Is it the kind of thing where a woman could go to work, go get radiation, and go back to work afterwards?
Absolutely. I would say the majority of my patients who are working full-time continue to do so. They'll pop in on a lunch break or do it right before or after. There can be some fatigue for patients.
I was going to ask about side effects.
Yeah, as they're going through treatment, and it's very patient dependent. So at consultation, I'll tell each woman, I have plenty of women that just keep working full time and they kind of do life without skipping a beat, and that's great. And I have other women that are kind of like, this is a lot. I'm tired.
This is wiping me out.
I can't focus at work. I need to do reduced hours, or I need to take time off. I need a nap in the middle of the day, or I need to go to bed a little bit earlier. And the thing is, it's all right.
That's okay
no
too.
matter what it is that you're feeling, it's all valid. So I always tell them, I'm like, give me your paperwork. I will write whatever you want. Like, you need reduced hours, or you want to be able to work the whole time, because it's very person dependent in terms of what their reaction and how they will feel. But the majority of patients are kind of just a little bit worn out or a little bit tired by the end of the day or the end of the week.
Can there be skin sensitivity? What are some of the other side effects, and not long-term, but short-term side effects?
Sure. So the most common one is that we do expect to see some sort of change in the skin by the end of the treatment course. I tell patients it's usually either some pinkness, redness, tanning. There could be dryness of the skin, peeling, itching, sometimes a little bit of a rash. That's the most common scenario. And then in a minority of women, there's more like a sunburn-like reaction where it can be a lot more tender and brisk or even blistering, but that's probably less than 15% of my patients nowadays.
So it's incredible what people will ask, and all questions are legitimate because
Absolutely.
it's information, right? But someone wanted to know, is there danger to others when a person is undergoing radiation treatment?
That's a great question, because I certainly get that from, these are women, they're mothers, grandmothers,
Right.
they're taking care of other people. And so the patients are not themselves radioactive at any given point. So they're perfectly safe to be around pregnant people, pets, children, et cetera. There are certain times when we deliver radiation treatments and, it's internal radiation, it's implanted into someone for other diseases, and that's a different scenario. But in the setting of, coming in for daily treatments and it being given externally, patients are perfectly fine to be around their
Is there
family.
any way for you to know when you've started this? I know there are protocols depending on the type of cancer and the staging, but for you to know that it's been effective or that you've done enough?
Right, that's a question I get very often. So the thing is, what we're treating with radiation is microscopic disease. There's no way to test for microscopic disease at this point in time. There isn't a scan or a blood test. It's based on risks and probabilities. So I will tell patients, we don't necessarily know that you individually need the radiation, because there's just no way of knowing. It's based on risks and the best literature and data we have available. So in terms of following, it's not like I can, do some sort of a scan after your last day of radiation and say, all right, we got every bit of it. That would be great for the patient if we could. It's more so time. And that's pretty much cancer in general. I know someone asked Dr. Dunnigan about cure and can you be cured and not, and it's a kind of a difficult and complex question. Really, the answer is time.
Yeah, it's sort of your new situation that you have to get your head around and figure out how you're going to live with it. When you talk about the microscopic treatment and trying to find any little cell, right, that might be cancerous or turn into cancer, you're obviously, I'm guessing, killing some good stuff too. You can't help that, right?
You sort of can, right? So I talked about the heart, right?
Yes.
How we can
I don't mean
work
a big
on
organ,
that.
but just even like healthy cells.
Right, and so that's right. So a question will be, why so many treatments, right? And, is it worse because I need 6.5 and such only had 2 weeks of treatment? So you could literally have the radiation that you need to eradicate any microscopic breast cancer in one treatment. However, that would literally kill the patient. This is the reason why it's so many treatments, because it's that balance of causing damage to the cancer cells such that it dies, but not causing so much damage to the majority of your normal cells that they cannot recover. So over those daily treatments and those weekends, those 24-hour periods and those weekends, your normal cells are able to detect, hey, there's an injury here, we need to repair this. Whereas cancer cells, they're altered, they're mutated. They can't necessarily detect that, or potentially can't repair it. So that's the other portion of why do treatments have to be daily and spread out over time. That's the balance, is trying to deliver as much dose to kill the cancer cells, but also such that we can—
That's the art of it again,
yeah.
based on studies. I think there was a question, and sorry I didn't get to you quicker.
Yes, no, that's okay. We have several questions from the audience. Can radiation ever be delivered while the patient is laying face down? Are there any— you want to let her answer that one first? Okay.
Yes, absolutely. So I talked about how we can use the breath hold for left-sided breast cancers. We can also treat patients face down using a prone position, which sometimes you can achieve a lesser heart dose, sometimes not. But yes, that is a potential. I will often implement that in somebody who has a larger pendulous breast, and when they're laying down and I'm examining them, I feel like if we were to treat them laying on their back, they would actually end up with a worse skin reaction. Because wherever you have folds is where the skin reaction is going to be worse and more intense. So when you flip someone over, the breast tissue falls forward and all of those folds open up. So that's definitely something that we use and is effective.
Good question.
Are there any long-term after effects of radiation treatment?
Absolutely. So the most common thing with breast cancers, I tell patients, is the breast is probably going to look, feel a little bit different permanently. So the color could be off. The feel of it could be different. So radiation can cause fibrosis or scarring wherever it hits. So the skin may not feel as soft and supple as the rest of your skin. It may feel a little bit
Lose sensitivity?
To you, when you touch it, it can feel leathery. Usually patients, there are some patients that will always have some sensitivity at the site of their surgery, but most patients don't. They actually don't have pain long-term from this. So there can be some cosmetic changes, the size and the shape. So there can be shrinkage. That breast kind of gets frozen in time, and the other one is going to do whatever it's going to do. So that can lead to asymmetry. Otherwise, we do worry about and take into consideration the impact on the heart. We know with increasing dose of radiation to the heart, there's an increased risk of cardiac toxicity years to decades down the road. This is related to how much dose, and that's why we do a really, really good job of measuring that dose and trying to keep it as low as possible, which, again, we have newer tools in our arsenal nowadays that allow us to achieve that. Ribs can theoretically be weaker. And then with radiation, why is it so scary is because radiation can cause cancers. So when I'm seeing all of my patients, at the end, when I'm consenting them, I always tell them that there's always a risk. It's typically 1% or so that the radiation can cause a cancer in the area of the high dose.
And last one, what is the probability of cancer reoccurring in the breast that has already been radiated?
And that's going to be very much so dependent on what kind of breast cancer you have, right? Because as we were talking with Dr. Fogarty, it's not just one disease, between your receptor status and the size and nodal. I mean, it's kind of a hard question to answer because it's very patient dependent. But typically low. I mean, it significantly reduces the risk of recurrence.
Thank you so much. I mean, it's interesting because I think we always think about chemotherapy, but it really seems as though radiation has taken almost a bigger role in more cancers. Not that chemo is not used quite a lot, but if you're getting a lumpectomy and you're bypassing the chemo, you're still getting the radiation.
Oftentimes,
so it's, you're busy.
Yeah,
thank you.
Absolutely.
Thank you, Dr. Patel, so much for sharing your expertise.
Thanks for having me. Thanks for listening, everyone.
Everyone's been great, but I have to say I think we're saving the best for last.
Yes, absolutely.
And that is a woman who has been through treatment and has been a patient of many of the fine doctors at GBMC, and who is so lovely in her pink, coming here to share her story with us. Thank you so much. Deidre Gardner?
Yes.
Thank you.
Dee. That's easier.
Thank you.
You're welcome.
So many women coming out and sharing their story, and it is a great community, as we talked about before, and I know that must give you strength to be able to also speak with someone who's new to the game and talk about what you've gone through. And so why don't you tell us your story?
Sure. So probably in 2011, and after I had gone through the mammogram and all that kind of stuff, and I wasn't one that regularly checked my breasts, even though you get all this literature when you go, check your breasts, and I didn't do it. And so one time just in the shower, and the spirit kind of told me, check my breasts. I checked it, I felt a lump. And so I went to investigate, have it investigated. And lo and behold, I was told that I had stage 0. That was the DCIS, stage 0. So my question was, is that cancer or what? What does that mean? So just in exploring, got connected to GBMC and went through the exploration, having the mammogram, the sonogram, not sonogram, ultrasound, and biopsy. And at that time, they explained everything and gave me my options. And what I decided was to go ahead and have surgery. So I did have the surgery. And at that point, it was like 5 years flowing free. That's all I had was surgery at that time.
And that would be a lumpectomy?
No, I actually went for the mastectomy.
Okay.
And after the actual surgery, it was discovered that it was a good option because they found more cells, cancer cells, in the other parts of the breast. So I was thankful, that decision, had made that decision.
This was after they did the pathology, after the surgery, they were able to tell you that?
Correct. And so, 5 years going free, just wondering, I'm healed, nothing worried, no concern about ever getting it again. I believed that I was cured, I was healed. And so 2016, went for my mammogram in April, everything was fine. Went to my oncology appointment, everything fine. And then in June, Spirit again, check your breast. went and checked the breast, and I felt more. It was the first time it was probably like a penny-sized lump, but the second time it was like a quarter size. And of course start feeling this is not happening. This is not true. Trying to investigate even more. No. Called the oncologist, and she was like, come on in. Came in, went through all the stuff, and found out, yes, you have breast cancer in the other breast. So during that first treatment, again, it was just surgery, no radiation, no other type of treatment. So what was decided this time was to do the chemotherapy to try to shrink it, and then go from there, decide what to do. So had the chemotherapy. I can't remember, but seemed like forever, but it was a long time. And after the chemotherapy, had the surgery. And at that time, it was also, so it had spread, it was not only in the breast, but it has also spread it in my lymph nodes in the right side. So we did the biopsy, all that kind of stuff again, and surgery. After surgery, it was decided also radiation. So I also had radiation. And in the course of that, found out after I thought, I guess I was finished with chemo and had radiation, went back for more testing, they had done the pathology test, and found out that I had HER2 positive, which meant I had to then continue with chemotherapy. It was like an infusion treatment along with radiation. And because the cancer, I guess, had come and aligned a little bit against the chest wall, that I had to have radiation, I guess, longer than the normal 6 weeks. I think it was about 8 weeks that I had. It was about 8 weeks, I believe, that I had the
And this is
radiation.
just 2 years ago, is that right? Or a year and a half
Right,
ago?
2016 through January, I believe, of 2018 is the treatment.
So you've been on a roller coaster with this. I can tell you're very spiritual.
Yes, there was nobody but God that's
Yeah.
helped me through, and of course GBMC. Thanking him definitely. Everyone was just really compassionate, really encouraging, just from every aspect, really. The surgeons, the radiologists, the oncologists, and the staff. Like everybody was really encouraging, and that made a difference, definitely.
Yeah, I'm sure it's really difficult when you're trying to process all of this, when you're the patient or you're getting the diagnosis. And they helped you understand exactly, because it feels like you got a lot of curveballs thrown at you.
Yeah.
Right? And
I'm sorry, go ahead.
No, and I was just wondering how you processed all of that, and their support system was there to kind of take you through it in the way that made you feel confident.
I think because they explained a lot, they gave you your options. So, they provided a lot of education. They would let you know, like, what the next steps are, and then allow you to make that decision. I mean, at one point, prior to the HER2 and then fusion, we actually thought that I might be a candidate for a trial, trying to see, I think the doctor was talking about earlier, having radiation, having the surgery and radiation, as opposed to, and I'll say this right, it was just the surgery. You might have to help me out, Dr. Patel, but Dr. Fogarty mentioned it. So it was a trial run to be able to do whether or not it's having the mastectomy, and if that would cure it, as opposed to the that one, and the radiation. But anyway, I didn't, after agonizing actually, after whether or not to participate in the trial, found out after I was diagnosed with the HER2 positive that I did not qualify for that particular trial. So that I had to go through with getting the radiation, surgery, and all of the rest of it.
How are you feeling now?
I'm blessed. I'm good. During the treatment, and I think I was one of those great patients that God just allowed to not experience a lot of what I hear others have gone through. So a lot of the treatment, like prior to the chemo, receiving the chemo, well, initially I was allergic to the chemo.
It's never
so
quite
during
easy,
the course, right, during the first treatment, found out that I was allergic, but they were able to give me Benadryl, so that was a treatment prior to getting the chemo, that I would get the Benadryl first and then the chemo. So, you just take your daily dose of medicine, and it's part of treatment. You just look at it as a process, something you have to go through to get to your healing, and just being really positive and, prior to, I guess, my first bout with the cancer, you get anxious when you get the diagnosis and wondering how you're going to tell your family and blah, 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 blah. Just really was sitting in church, and the pastor had announced the scripture that I went to, and it basically told me that I was not going to die but live and declare his works. So I stood on that scripture for that first bout of cancer, and so that's why at that point I just knew I was healed. Went back 5 years, celebrated, even though it was short-lived. But again, just knowing that that first time was for me, the second time was for others, that they can see even in the midst of what you experience, you can get through. You can get towards your healing with that victory and trusting in God. Mm-hmm.
You must have had some dips in your mood, some low points. What was the hardest part for you about this particular journey?
I think I thought the hardest part was really disclosure, or not really knowing what to expect, because you saw people that, I had experience of knowing a couple of people who had breast cancer but really didn't walk with them through their journeys. So the only thing I knew is that they had become bald head, and that's it. And so, and going through it my own self, it was it's more than that, even though throughout the way GBMC kind of explained the different things that may happen. And a lot of what was explained may happen, I really was blessed that I did not experience. So, some of the nausea and all that, they treat you so that I really didn't have those experiences. The fatigue, I guess the hard thing was just really how my family would perceive it, and I just keeping people who were maybe negative out of your space, because if anyone tried to show pity, it was no, I don't want you in my space right now, because I need everyone to be positive and know that what I believe is going to happen is going to come to pass.
And I think that was my next question, is what you would tell other women who are in treatment or just being diagnosed or even years past it. What for you was key and instrumental for you in keeping positive and moving forward? Because obviously a positive attitude is going to help your outcome in the end, right? But you can say that a million times to someone, and if they're struggling, right? So you did point out to surround yourself with people who are going to be in that place with you and tell them what you needed.
Correct. And I think, just allow yourself, because we are going to go through a roller coaster of emotions. So allow yourself to feel the way you're going to feel. Don't discount it. Allow yourself to feel it, but don't stay there. Because that pity and that negativity, it's going to work on you, and it's going to make you feel depressed, and it's going to give you, make you want to give up. So I would say, stay positive. For me, scriptures, reading from Genesis to Revelation, just scriptures on healing. So sometimes at night, what I would do is go to YouTube and just Googled healing scriptures. And so throughout the night, those healing scriptures were being echoed in my mind, echoed in my spirit, so that I could stand on that as well. Ask questions. If you don't understand, ask those particular questions. Definitely pray about it. And for me, it was trusting God that He's going to come forth with His word. And also believing that if the healing didn't take place on this side, it would take place on the other side. But believing, too, that there was still more work for me to do. And so I think with that...
what is the work for you to do?
To declare His works, that I'm a living testimony that you can get through it. It can be difficult, it may be hard, but you can. You have to really surround yourself again with that positiveness. Ask your doctor questions, kind of, work with them as well, because God has placed different medicines and different people here to help see you through. So I would say, trust it. And even, again, if you need to scream, yell, holler, whatever you need to do to get you through, but just don't stay there, because that's where, again, that spirit. And sometimes, and if it comes to the point where you can no longer go on, and I look at it as this body can no longer hold my beautiful self. And so there's part, my work down here may be done. So, just even in walking through and just seeing and others seeing how you can walk through, it will give them encouragement that they too can, get through whatever, because we all have trials and tribulations, different challenges that we're going to experience, whether it's breast cancer or something else. And the way we handle it, does make a difference.
Yes, amen.
It does,
Thanks for sharing your light
You're
and joining
welcome.
us,
Thank
and
you.
good luck, and I'm glad you're
Thank
feeling
you.
good and strong, and
Yes.
we really appreciate it. And thank all of you for joining us, and there's so many more discussions to have about breast cancer. So many of us are in this community and have relatives who are, and it's been a wonderful hour plus talking about it. So
Okay.
thank you.
Thank
and that's
you.
Greater living.
Thank you. Thank you.
It's so nice
Thank
to
you.
meet you. That was great.